I knew I was interested in being a nurse as I was approaching the end of my graduating year. Our animal veterinarian told us about a new animal technician program that was starting up out of Tacoma, Washington, and that's where it all started. I applied and got accepted in the fall of 1970. In its infancy, we were not yet certified, but eventually I got licensed as the first graduating class in Washington State. My first real job was with Snohomish Veterinary Clinic. I learned how to do reception work, kenneling, which included cleaning, feeding, bathing, and self-taught myself to do grooming too. I must admit, I did a pretty good job on poodles, cockers, and schnauzers. I learned how to monitor animals under anesthesia and prep them for surgery. I was delighted to learn how to monitor a foal under anesthesia. I was watching one of the vets perform a surgery on a dog one day. After some time went by, I quickly realized that this was not a normal surgery. They failed to tell me that they were amputating a dog's leg. It was quite a shock for me. After 4 years of this, a great opportunity came to light. Pilchuck Veterinary Hospital had an opening for a licensed vet tech. At the time, this hospital was the largest multi-practice veterinary hospital west of the Mississippi. I had the pleasure to work in small animal care under the direction of their orthopedic surgeon. Other than your normal orthopedic fracture repairs, we performed numerous spinal surgeries and total hips. It was a delight to watch animals coming in such severe pain or partially paralyzed finally walk normally again after leaving. We actually salvaged bones from dogs being euthanized and put them in healthy dogs with shattered legs too. I learned the art of intubating and monitoring the patients. I also learned to do all of their lab work, including microbiology. As with many businesses, people change and so do practices. So they created a new position for me in the scrub room. This turned into a full-time job doing surgical packs for the small animal and large animal departments. I made up numerous drugs primarily for the equine and bovine department. I made up saline for surgery use and as an IV for the cows. Eventually, the equine department hired me to be their large animal surgery technician. There I helped with inducing, prepping, and sometimes helped with the surgery too. My job was to have the surgery room fully stocked and hand out packs and miscellaneous items as the surgery was in progress. In between, I was taught to sedate, position, and prep cows for a DA surgery. Some unique surgeries would be doing a root canal on a cougar, pinning an eagle's wing, and preparing an ostrich's knee. I truly loved my job. I put 17 years of work in there. Unfortunately, my husband had a midlife crisis and we purchased a gas station. That then led me to leave my vet tech job. However, I eventually went back to vet teching at a small vet clinic near my new home. I worked for 6.5 more years there and then retired. While the pay wasn't the best, my love for helping animals of all kinds was truly my priority. I will never regret my time and experience from the past 40 years in the industry.